Hello everyone, welcome to Learn Medicine Easily YouTube channel. If you did not subscribe our channel up to yet, so kindly subscribe our YouTube channel. Also push the bell button to receive our videos notification first. So today we will start our lessons with the ECG part 3, but before I really want to go explain the remaining electrophysiology of the heart, I'm fun to explain all the things we have studied up to yet. So in the ECG part 1 we studied that what is ECG. So ECG is electrocardiography in recording of electrical activity. As you know, the heart has a special electrical activity, so recording of these electrical activity is called ECG. I will briefly review all these things so you can put it in your mind, the importance of ECG and all the features you should know. So then we came to the uses of ECG. So in which condition we can use ECG, I will briefly show you these things. We can use it in hypertrophy of heart chamber, so a special type of changes will come in the ECG of the patient, and you should know that he or she have which problem. So these are the condition you can use the ECG. And also then we came to ECG leads. As I told you, each leads are the electrodes recording ECG from patient. So and then we told that we have 12 leads, mainly that 3 leads are bipolar leads. 12 leads, we have 12 leads in 3 types. 3 leads are bipolar, 3 leads are unipolar, and the other remaining 6 leads are chest leads. So you can say like this: 3 leads and then again 3 leads, and this is 6 leads. So all these leads are 12 leads. So bipolar leads recording potential gradient between extremities. So L1, L2 and L3. I have you can follow the previous video, and also if you have any suggestion, any question, you can put it in the comments, and I will be responsible for these things. And then we came to the other part, unipolar leads. As I told, they consist 1 positive electrodes you can see these leads here, and then we came to chest leads. So we told that we have 6 chest leads which are located in the first 2 in the 4th intercostal space, 4th intercostal space, and the remaining in the V3 is between V4 and V2. V4 is in the 5th intercostal, and also V5 and V6 are in the 5th, but V5 in the anterior axillary and V6 in the middle axillary line. So then we came to ECG part 2. In the ECG part 2 I have explained some electrophysiology of the heart, and some of the electrophysiology of the heart is remaining, and today I will tell you those things. So we should know the factors which are producing ECG first of all. So factors producing ECG, I told you that there are 4 factors mainly. The first of all is when electrical impulses produced in the pacemaker, then it come through the His bundle. It should conduct through the His bundle and then come to the myocardium. In the myocardium it causes the depolarization. In the myocardium it causes the depolarization, mean they change the charge location. It causes the depolarization. And then the 4th factor, that this cell from this depolarized condition should again go to the rest condition, which process is called repolarization. It should come to rest shape like this. The inside is negative and the outside is positive. When there is no stimulus, so the outside is positive and the inside is negative. So then I told you the normal heart pacemaker is SA node located in the superior lateral wall of the right atrium, and then we came to the conductive pathway or conduction of these impulses through the conductive system. As I told you, this conductive system consists of 5 components: SA node, AV node, bundle of His, or atrioventricular bundle branches, and then Purkinje fiber. In the very remote point, you have Purkinje fibers, and also you can easily know this cardiac conductive system. So today the ECG part 3, as I told you, ECG, for taking a ECG, there are 4 factors have a special role in the ECG producing. Factor 1 was the producing electrical impulses in the pacemaker. Then it should conduct through a conductive system. So the second was the conduction. What? The conduction through the conductive system. So then the impulse come to the myocardium. And cause the depolarization of myocardium. And this depolarization is the third factor. Today I will explain these third and the fourth factor, and then again it is normal shape, that again it will be minus and it will be outside will be positive. So today we will focus in these 2 factors. So before we really go to explain the third factor, or depolarization, so you should know some special expression like electrical potential, intracellular potential, rest membrane potential, and also action potential. So you should know these things. When you understand these things, you can really and easily understand that depolarization. So the first thing is electrical potential. Electrical potential is actually the difference of potential energy between 2 electrical locations. So when we have 2 electrical locations, suppose this is a cell membrane, and here we have the different concentration of ions, and also in the inside we have different concentration of ions. So the difference of these potential energy in the 2 locations is called the electrical potential. So what is potential energy? Actually, you can easily say the potential energy is the energy held by one object. So if you have 2 objects, so one is here and another one is here in the upside. So this energy which bring this second object to the first object. Suppose it is the earth and this is a high point. So if we bring this object from this point to this point, so it will hold some energy. This energy is called potential energy. When we leave this object, it will go again to the first position. So this energy is called potential energy. So then we will come to another point, intracellular potential. What is intracellular potential? As you know that the cell has electrical ions, or ions in the outside and inside of the cells. When we put a micro electrode, so what is this? This is a micro electrode. When we put a micro electrode to the inside of the cells and also put another electrode to the outside of the cells, the machines record some potential. So this potential is called intracellular potential or cellular potential. So you can say that this potential is intracellular potential. In this picture you can again see we have put an electrode to the inside of the cells and another electrode to the outside of the cells, and this machine is recording some electrical potential. So this electrical potential is called intracellular potential. And then you can see in this picture ion concentration outside of the cells and inside of the cells. So you can easily see that in the outside of the cells there are low amount of potassium and high amount of sodium, and also high amount of what? Chlorine. You can easily say sodium and chlorine is high in the outside of the cell or in the extracellular matrix. Extracellular matrix. These are high in the extracellular matrix, and in the inside of the cell potassium level is high, and then these 2 ions, sodium and chlorine, is less. And also you can easily say that this concentration of potassium, only potassium is low in the outside and it is high in the inside. And then So if you want to remember it easily, so you should know that these ions you should remember. So you can easily say that two ions, sodium and chloride, are high in the outside. When they are high in the outside, so in the inside they will be less, and potassium is low in the outside. So if it is low in the outside, in the inside it will be in a high level. In this picture you can see the semi-permeability of cell membrane, that the cell membrane allows potassium through it to go out inside of the cells, but they did not allow the sodium and chloride. So you can see the semi-permeability of the cell membrane. And then we should know the other things. Rest membrane potential. What is rest membrane potential? As I told previously, that normally all the cells has a charged ions inside and outside of their membranes, outside and inside of their membranes, which is called rest membrane potential. So this is a static potential. It means that there is no stimulus to the cells, and these cells have a potential which is called rest membrane potential. So but some special type of cells has the ability, all the cells, as I told, all the cells have these charges, but some special type of cells has the ability to respond to the stimulus. So these are especially muscle cells and nerve cells. You can see these rest membrane potential in this picture easily, that normally in the inside of the cells we have minus charges, in the outside we this is outside of the cells and this is inside of the cells. In the inside we have minus charges, in the outside we have positive charges. You can easily see these things in this picture. All the cells has charge like this, but special type of cells can respond to a stimulus and they change their location of charges. It means inside will be positive and outside will be minus, become minus. In this condition is called depolarization. I will call it later. So first before of depolarization definition and explanation, I want to explain this threshold potential. So what is threshold potential? All the cells have a potential, you know, but when we bring the potential of the cells to a point in which a little stimulus or a very little stimulus, so when a very little stimulus can start the depolarization, so this point is called threshold potential. So it means the normal potential, rest membrane potential, is in this point, but when some stimulus or some special stimulus bring its potential, increase its potential and bring it to a point in which point a very small stimulus, very small stimulus can depolarize the cell. This point is called the threshold potential. You can easily see it in this point. So what is potential? You can see it easily in this picture, that this cell is in normal or rest membrane potential. When a stimulus coming and stimulate this cell, so the outside charges are becoming minus slightly. It is becoming a minus in this propagate to the other side of the cells. In the inner side are becoming positive, and then all this depolarization is occur. This is in the depolarization point. It means that the inside of the cells become positive, in the outside become minus. So this condition is called depolarization. What is depolarization? Depolarization is the changing of charge location around the cell membrane, in which the inside of the cells become positive, in the outside of the cells, in the inside of the cells become positive, in the outside become minus. This condition is called depolarization. So this depolarization is the third factor which produce ECG. And then again the repolarization again, these minus charges will from one side to another side will come to the normal condition. Positive charges, positive in the inside will slightly correspond in synchronization with the outside will become minus, and then the normal condition again like this will occur, which this process in which depolarized cell converting to a normal or rest membrane potential, this process is called repolarization. So in this repolarization is the fourth factor in which produce the ECG from the patient. So thanks for your attention. If you did not subscribe our YouTube channel yet, so please subscribe our YouTube channel and also share our YouTube channel with your friends, and also don't forget to push the bell button to receive our videos notification.